Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 16th of June 2021. The story about our numbers today in terms of COVID is that they're up a little bit from last week. Today we've got 9 COVID positive patients in the hospital and another 2 who are in because of COVID and are post 14 days. Of those 9, 7 are in our general beds in the hospital and 2 are in critical care. I think what's also striking about these 9 is that 5 of the patients have not had any COVID immunisation and 1 has had only 1 dose. So we're seeing a real pattern which reminds us how important it is for everybody to get vaccinated. And anyone over the age of 21 now can go on the NHS UK website and book a vaccination. So if you are 21 or over, or you become 21 this month, please will you go on the site and book yourself a vaccination. And if you haven't had your second dose and you think you're due it, please will you also make sure that that's brought forward, because it seems to be the most important thing that we can do collectively to reduce the risk to ourselves but also to our society. So important. And of course the Prime Minister has pledged that we will get to everybody over the age of 18 by the middle of July. So if we can really crack on, that would be fantastic. In fact, the immunisation rates across the area are good. We can see that for Blackpool, 59% of the population have had both doses, 68% for filed and 70% for wire. So those numbers for second doses are good. You can see there's still a way to go. If we look at the prevalence of COVID at the moment, it's pretty much doubled since last week actually. So for Blackpool it's showing 199 per 100,000, for filed 144 per 100,000 and for wire 87 per 100,000. The figure for Blackpool last week was 103, so you can see that it's pretty much doubling. So if I'm saying the same thing next week, you know, we're really seeing a very worrying, sharp spike in prevalence. Perhaps a good news bit of that story is that these spikes are in the under 60s by and large, and that again reflects the vaccination rates. So it's the same message. Please, please, if you're due a vaccination, please make sure it's done. We've had no new deaths reported since last week, so our total is still shown at 766. So there's a bit of good news in that story. And of the genomics of the COVID positives that we're picking up, we're certainly seeing the Delta variant. So it looks like that is the type of COVID that's spreading rapidly across the population. We haven't changed our visiting regulations, but we are reviewing those daily as we see the prevalence changing across the community, and I could see there could come a point where reluctantly we decide to change our visiting rules. They're always on our website, so if you're in any doubt, please will you check with that. What I would ask is, because it's so easy to get lateral flow tests from the pharmacy and test yourself, if you are coming to hospital to visit a loved one or to come to a clinic, if you can test yourself with a lateral flow test before you come, I think that's massively in your interest as an individual, but also of course in terms of our population that we're serving. So we haven't made that mandatory yet, but we would ask that if you can test, that would be great. And if possible, if you're coming to a clinic or to visit somebody, if you can come by yourself rather than as a group, that's also very, very helpful. So thank you for that. Very easy to get tested, of course, and I've talked before about going on the NHS website or dialing 119 to get that done if you're in any doubt about whether you've got symptoms. I think finally, just to remind everyone about our emergency department being so busy, and in fact the whole of sort of unscheduled care being busy across the Fylde coast. Of course, the emergency department is there for a reason, to help people who have emergencies. So, you know, if there are trauma injuries, then this is absolutely the right place to come. And emergencies that you think cannot be managed in other ways, of course, we need you to come and see us, and that's what we're here for. But we've seen quite a lot of people with perhaps long-standing illnesses where it could well be that a call to 111 or a call to your own GP practice might give you a better experience and also perhaps more connected care. So I'd ask you to think about that if you would. And finally, of course, because of this prevalence of COVID now coming up so rapidly, the issues around social distancing, maintaining 2 meters, wearing a mask in public spaces, and making sure we all wash our hands regularly to reduce the possibility of transmission of COVID remain so important. Thank you as ever.